I want to talk about an MS breakthrough today. And before you panic, no, it's not a cure, and no, it's not on the news. Which is actually the weird part, because this one is already changing how MS is studied and treated. But it's not flashy, it's not dramatic, and it doesn't fit in a headline, so almost nobody is talking about it. So let's break down what it is, why it matters, and why this might be one of those we didn't realize how big this was until later moments. First, we need to have an honest conversation about the word breakthrough. In the world of chronic illness, that word is loaded with a dangerous amount of hope and a long history of disappointment. When most people hear it, they immediately picture a miracle. They imagine a single pill that erases all symptoms. They imagine a one-time treatment that restores a life once lived. This is not that. This is not the Hollywood version of scientific progress. It's something quieter, but arguably just as powerful in the long run. If you have lived with MS for any length of time, you have likely developed a healthy skepticism toward that word. A so-called breakthrough often translates to something like, "Oh, that's interesting for people who will be diagnosed 10 years from now. But my legs still feel like they're filled with wet sand." I get it. The gap between a scientific discovery and a tangible change in your daily life can feel like a chasm. So, for the purpose of this discussion, I will use the word breakthrough carefully. This particular breakthrough is a conceptual one. It is a shift in how we see and measure the disease. It is a tool, not a cure. Imagine trying to build a complex piece of furniture with only a hammer. You can get some things done, but it's clumsy, inefficient, and you will probably smash your thumb a few times. Now imagine someone hands you a full set of precision screwdrivers. Imagine a level. Imagine a power drill. The furniture is not suddenly built, but your ability to build it correctly, quickly, and with far less frustration has just improved exponentially. This is that kind of breakthrough. It is an upgrade to our entire toolkit. It allows researchers to work smarter, not just harder. It provides a new layer of information that was previously missing, helping to explain why the disease behaves so differently from one person to the next. Now, for the big idea. This breakthrough is not a drug. This breakthrough is not a surgery. This breakthrough is not a therapy. That is the primary reason it is so easy to miss. It does not come in a bottle or a syringe. It lives inside laboratory reports. It lives in complex spreadsheets. It lives in the digital outputs of advanced imaging machines. It lives in the subtle chemical changes within a drop of blood. It lives in the faint patterns on a brain scan. Finding better ways to spot the presence of MS, predict its course, and measure its activity with incredible precision. Scientists have a word for these signs: biomarkers. Think of biomarkers as tiny biological flags. They are measurable indicators of what is happening inside your body. Your cholesterol level is a biomarker for heart disease risk. Your blood sugar is a biomarker for diabetes. For MS, researchers have been on a long hunt for more sophisticated flags. This brings us to a fundamental disconnect between what excites a researcher and what gives hope to a patient. Researchers, by their nature, are obsessed with early signals. They want to find the first whisper of trouble, the earliest possible clue that something is going wrong. Their goal is to understand the cascade of events that leads to a problem. If you can spot the very first domino before it starts to fall, you have a much better chance of intervening effectively. You can design smarter experiments, test new ideas with more accuracy, and ultimately learn what works and what does not, faster. For a person living with the daily realities of MS, this focus on upstream invisible signals can feel abstract and irrelevant. Patients want felt change, and they want it now. They want the fatigue to lift, the pain to subside, the brain fog to clear, and their strength to return. That is not just a reasonable desire. It is the entire point. The lived experience of a chronic illness is not about p-values or protein levels. It is about the ability to walk to the mailbox, to hold a coffee cup without spilling, or to remember a grocery list. When a scientist gets excited about a new way to measure something you cannot feel, the reaction is often a weary shrug. Imagine your house represents your body. For a long time, doctors and researchers have been focused on fighting the fire. They see the flames, the relapse, the new lesion on an MRI, the worsening disability, and they rush in with fire hoses, our current treatments, to put it out. But now, researchers have invented a new, highly sophisticated smoke alarm. This alarm can detect the faintest wisp of smoke, long before any visible flames erupt. It can even tell you which room the smoke is coming from. The smoke alarm does not put out the fire. Owning a smoke alarm does not magically make your house fireproof, but it changes the game completely. It gives you a critical head start. It allows you to use a small fire extinguisher instead of needing the whole fire department. It lets you act sooner, more precisely, and prevent catastrophic damage before it ever happens. This is the value of early biomarkers. They are the smoke alarms for MS, and while they don't fix the current damage, they are our best hope for preventing future fires. The slow, steady payoff. Why this matters for the future. First, much earlier, more definitive diagnoses. Many people endure a long and agonizing diagnostic odyssey, waiting months or years for symptoms to fit a pattern. Bounced between specialists, undergoing test after test, living in a state of uncertainty. Better biomarkers could dramatically shorten that painful wait, giving a clear answer sooner and allowing treatment before more damage. Second, clinical trials. Reimagined. MS varies widely. One drug can help some and do nothing for others. Precision profiling selects participants most likely to benefit. Clearer results, fewer failed trials, faster path from lab to pharmacy. Third, truly personalized treatment. Shift from, let's try this, to based on your biological signals. This treatment has the highest chance of success with the lowest risk. Fourth, fewer wait-and-see moments. More sensitive biomarkers can reveal activity even when things look stable. All of this ties back to the bigger theme. Research acceleration matters. It is the work that makes all future work better. In the spirit of honesty and building trust, we must be crystal clear about what this type of advance does not do. First and foremost, a new biomarker will not erase your existing MS symptoms. It will not repair old damage to your nerves. It will not make the tingling in your hands or the weakness in your legs disappear overnight. Its primary function is predictive and preventative, not restorative. Furthermore, this breakthrough will not work perfectly for everyone. The disease is complex. One biomarker or even a small panel will not capture the full picture for everyone. Some profiles will be clear, others may remain ambiguous. It is a step toward precision, but not a magic 8-ball. There will still be uncertainty. Doctors will still need clinical judgment and experience alongside these new tools. We must also be realistic about the timeline. Years of validation, standardization, and regulatory approval. At first, tests might be expensive, not covered, and limited to major centers. If this were a magic fix, it would already have a giant marketing campaign and a celebrity spokesperson. It doesn't. Given all those caveats, you might ask, why should I care right now if I can't feel the change and it might take years to reach my clinic? The answer: it starts to change the conversation with your healthcare team today. Knowledge is power. Understanding where research is heading lets you ask smarter, forward-thinking questions. It shifts you from passive recipient to active partner in your long-term health. Ask if any advanced imaging or experimental blood tests are available through research programs. New insights can refine your treatment plan, making decisions less about guesswork and more about data. Discuss trials using biomarker profiles to match patients with promising therapies. Use simple conversation starters to focus on practical outcomes and whether tests would change your current plan. We'll need clear guidance from experts and patient organizations, and we must advocate for equitable access. Good research and responsible implementation must go hand in hand as these tools roll out. We often miss the most important stories in science because they lack drama. We crave the simple narrative: a problem, a hero, a magic solution. A story about improved data processing and subtle biological signals does not fit that mold. It's more like a tougher asphalt for road construction. Foundational, crucial, unglamorous. You know it prevents potholes and makes travel smoother, But you don't throw a parade. This quiet advance accelerates everything. More successful trials, faster diagnoses, more personalized treatments. It's the scaffolding before the skyscraper. Let's peel back the layers of this understated discovery. The lack of a headline is exactly what makes it compelling. This quiet, under-the-radar breakthrough is a file this away for later moment. It won't make headlines tomorrow or provide instant relief, but it's a turning point. It builds a stronger foundation for exciting treatments and potential cures. It enables breakthroughs to happen faster, smarter, more effectively. If you want, I can do a follow-up on how this shows up in real appointments. Let me know. And of course, it raises the big question: will we cure MS in our lifetime? Nobody knows. But this work makes a cure more plausible, turning the winding road into a clearer highway. If you found this useful, please consider subscribing or liking this video. It helps us cover quiet, important science. It lets us dig deeper than headlines and provide context that matters. Questions, ideas, or experiences? Drop them in the comments. The conversation is just as important as the content.